Why are many men drawn to kissing a woman's most intimate area? You know what I'm talking about. Also, tell me in the comments whether you want it from her or not. Is it only sexual, instinctive, or supported by science? I'm Noah, a men's health specialist. In this sex education episode, we examine medical, psychological, and physiological insights behind this intimate behavior, including its links to pleasure, bonding, and conditions like erectile dysfunction. If you care about genuine sexual health for both men and women, this discussion is designed specifically for you and provides clear, evidence-based explanations you can trust and apply confidently. Many couples ask, Noah, my partner enjoys oral contact with my vagina. Is that normal, healthy, or strange? I want to be clear. This behavior is normal, widely practiced, and when consensual and hygienic, completely healthy. It is neither a disorder nor a perversion. This behavior is a natural part of human intimacy. Let's examine the science behind it. First, it supports emotional bonding, not just physical pleasure. From a psychological perspective, stimulating the vagina can create deeper emotional closeness between partners. Research shows that intimate touch releases oxytocin, often called the bonding hormone, which strengthens trust and attachment. For many men, this act communicates care, attention, and a desire to provide pleasure. That emotional reassurance can even improve performance in men experiencing erectile dysfunction, as anxiety decreases when emotional intimacy increases and partners feel more connected, relaxed, and secure together. Second, female anatomy is structured for external stimulation. Most women do not achieve orgasm through penetration alone. The clitoris, which contains over 8,000 nerve endings, is the primary organ responsible for pleasure. Oral stimulation directly engages this area more effectively than intercourse alone. Understanding this distinction significantly improves sexual health outcomes and relationship satisfaction. Third, it enhances arousal and natural lubrication. From a physiological standpoint, women require time and stimulation to reach optimal arousal, making this form of intimacy an important component of comfortable, pleasurable, and fulfilling sexual experiences. Oral stimulation increases blood flow to the vaginal region, supporting natural lubrication and reducing dryness, particularly after menopause. This leads to more comfortable and enjoyable sexual experiences. It is especially beneficial for women experiencing menopause, vaginal atrophy, or postpartum changes. Fourth, it contributes to male confidence and a sense of masculinity. When a man helps his partner reach orgasm, dopamine and testosterone levels can increase. This sense of achievement enhances self-esteem and may positively affect libido, as well as mild erectile dysfunction symptoms. As a urologist, I consistently emphasize that mental state and confidence are just as critical as physical factors like blood circulation in determining overall sexual performance and satisfaction. Fifth, visual and sensory stimulation plays a significant role for men. Being physically close allows engagement of multiple senses, including sight, smell, and touch, activating various pleasure centers in the brain. When hygiene is maintained, natural scent, influenced by pheromones, can enhance arousal. However, any unusual odor, infection, or symptoms of sexually transmitted infections should be medically evaluated. Sixth, this act reflects trust and vulnerability rather than dominance. A woman allows access to a highly sensitive and private area, while the man focuses entirely on her pleasure, reinforcing emotional safety, trust, and mutual respect within the relationship. This shared vulnerability strengthens intimacy and is essential for long-term relationship health. Seventh, it can assist men dealing with premature ejaculation. From a clinical perspective, oral stimulation allows intimacy without immediate penetration, reducing performance pressure. This method is often recommended in sex therapy to help both partners experience satisfaction. Eighth, it helps reduce performance anxiety associated with erectile dysfunction. Men who focus on their partner's pleasure rather than their own performance often experience reduced stress. Lower anxiety levels are directly associated with improved erectile function, making this approach a valuable psychological and physiological strategy in modern sexual health treatment. This is why modern erectile dysfunction treatment includes psychological and intimacy-based approaches, not just medications such as Viagra, Sildenafil, Tadalafil, or Cialis. Ninth, testosterone influences curiosity and the desire to explore. Biological drives encourage novelty and stimulation, but responsible sex education emphasizes that these instincts must be guided by respect, communication, and consent. 10th, this behavior is often rooted in giving rather than receiving. Many men engage in it primarily to please their partner. That sense of generosity and attentiveness strengthens emotional bonds and contributes to long-term satisfaction, trust, and stability within healthy, mutually fulfilling relationships. 11th, it can help women overcome body insecurities. Many women experience concerns about appearance, scent, or judgment. When a partner shows genuine enthusiasm and care, it reinforces a powerful message of acceptance and desirability. This reassurance can significantly improve mental well-being, confidence, and libido. 12th, it promotes equality in sexual pleasure. Historically, female pleasure was often overlooked, but modern sex education emphasizes balance and mutual satisfaction. Encouraging both partners' needs fosters healthier, more respectful, and emotionally fulfilling intimate relationships. A healthy relationship values both partners' pleasure, not just penetration. 13th, mindfulness and intimacy plays an important role. This form of connection requires full attention, eliminating distractions and rushing. That presence enhances both emotional and physical satisfaction. 14th, it revitalizes long-term relationships. Routine can reduce desire over time, but introducing variation and intimacy helps maintain excitement, strengthen connection, and sustain sexual energy even after many years together. Exploring different forms of intimacy can reignite passion and deepen connection in relationships. However, there are situations where oral sex is not recommended. From a medical perspective, it should be avoided if there is an active vaginal infection, unusual odor, visible sores, ulcers, or symptoms of sexually transmitted infections. It is also important to avoid engaging immediately after douching, as this disrupts the natural vaginal microbiome. Proper hygiene is sufficient, as the vagina is naturally self-cleaning and does not require harsh cleansing methods. Harsh soaps and routine douching should be avoided to maintain natural balance. For a safer and healthier experience, we have developed a comprehensive medical guide covering these conditions, including effective solutions for vaginal odor and infections. You can explore our detailed Vaginal Health 101 series with Dr. Emily on Tim Wellness. For couples, open communication is essential. Discuss preferences, comfort levels, and boundaries honestly to ensure a mutually satisfying and respectful experience that prioritizes both partners' well-being. Boundaries are essential, and true sex education begins with honest communication. For men experiencing prostate or urinary conditions such as BPH, frequent urination, or overactive bladder, confidence can be affected. Similarly, prostate cancer treatment or PSA-related stress may influence intimacy. Expanding intimacy beyond penetration helps couples understand that sex is not solely defined by erections. The key message is simple. Meaningful intimacy is built on emotional connection, understanding, and shared experience rather than performance alone. Whether you are facing erectile dysfunction, low libido, menopause-related changes, mental stress, or relationship challenges, it is important to remember that great sex is not about perfection. It is about presence, connection, and understanding. I'm Noah, urologist and men's health educator. If you found this sex education helpful, consider liking, sharing, and subscribing. Feel free to ask questions about sexual health, erectile dysfunction treatment, prostate health, or intimacy. Together, we can build healthier bodies, stronger relationships, and more fulfilling sex lives through knowledge, communication, and mutual respect. Don't forget to follow and stay connected. We are always here to support and guide you. See you soon in the next informative and helpful video.